Welcome, everybody. Welcome to the California Interagency Council's quarterly meeting. My name is Julie Lowe, and I have the privilege of serving as the Executive Officer of the California Interagency Council on Homelessness. I'd like to extend a welcome to our council members, members of the public, and other attendees. I'd like to also extend our gratitude to staff of Cal ICH's member departments and agencies who have participated in an active series of prep in advance of this meeting. And finally, to our esteemed guest speakers, we are grateful that you're bringing your expertise to this body. Thank you to everyone for joining us today for our first meeting of this body since our transition from the Homeless Coordinating and Financing Council to Cal ICH. Before I pass our meeting to our co-chairs, which I'll do shortly, I want to give a couple reminders. The meeting materials include much more than what we have on our agenda. I encourage you to take a look at in particular at the department and federal updates. It is apparent that each department here is working hard to address homelessness. These departments have reported great progress on their programs and have provided some insight and statistics of projects here in the state and in the federal government. So let's get started with this meeting. On behalf of our co-chairs, Secretary Castro Ramirez and Secretary Galley, the California Interagency Council on Homelessness is hereby called to order on this day, January 27th, 2022 at 1:08 p.m. Will Cal ICH staff member Evan Mapson please call roll?
Yes, thank you. So I will say the name of your department or organization. And if you can please respond with your name and your title. And if you're sitting in on behalf of somebody else within your department. So Council Co-Chair from the Business, Consumer Services and Housing Agency.
Here, Lourdes Castro Ramirez.
Thank you very much. And that's Secretary Lourdes Castro Ramirez. So Council Co-Chair from the Health and Human Services Agency.
President Mark Galley, Secretary.
Thank you. Council member from the Department of Aging.
Good afternoon, Susan DeMorris, Director, Department of Aging.
Thank you. Council member from the Department of Corrections and Rehabilitation.
Plain Allison, Secretary for CVCR.
Thank you. Council member from the Department of Education. All right, council member from the Governor's Office of Emergency Services.
Good afternoon, Lisa Monga, Chief Deputy Director here, and I'm sitting in for Director Mark Gillarducci. Happy to be here.
Thank you very much. Council member from the Department of Healthcare Services.
Good afternoon, JC Cooper, State Medicaid Director.
Thank you. Council member from Higher Education, so from the community colleges.
Good afternoon, Rebecca Ron O'Shaughnessy, Vice Chancellor of Educational Services and Support.
Thank you. Council member from the Department of Housing and Community Development.
President Gustavo Velasquez, Director of ACD.
Thank you. Council member from the California Housing Finance Agency.
Good afternoon, I'm Tina Johnson Hall, Executive Director of Cal HFA.
Thank you. Council member from the Department of Public Health.
Good afternoon, Tomas Aragon, Director.
Thank you. Council member from the Department of Rehabilitation.
Good afternoon, George Xavier, Director, Department of Rehabilitation.
Thank you. Council member from the Department of Social Services.
Good afternoon, Kim Johnson, Director, California Department of Social Services.
Thank you. Council member from the Department of State Hospitals.
Good afternoon, Stephanie Clendenin, Director for the Department of State Hospitals.
Thank you. Council member from the California Tax Credit Allocation Committee.
Good afternoon, Nancy Robles from the Tax Credit Allocation Committee.
Thank you. Council member from the Department of Transportation.
Hello, I'm Elisa Becerra. I'm the statewide lead on homelessness. I'm in for Director Tokes Omashakin.
Thank you. Council member from the Department of Veterans Affairs.
Good afternoon, Vito Imbasciani, Secretary of CalVet.
Thank you. And council member from the California Workforce Development Board. And council member appointee from the Senate Committee on Rules. Ms. Loving, I believe, are you present?
I am. I just did not know that was me. I apologize.
Yes, sorry, yep. So council member appointee from the Speaker of the Assembly. So Ms. Anderson.
Thanks, Evan. Amy Anderson, Senior Vice President with Wells Fargo's Foundation.
Thank you very much. So we have 18 members present. We do have a quorum of members present.
Thank you, Evan. Before we move on to our next agenda item, I have just a few logistics to go over to help with the conversation run smoothly today. I'd like to remind all members of the public that we will take public comment before any council action item and on informational items as time allows. We will also provide time for general comments at the end of the meeting. To help our meeting stay on track with time, please make sure your comments are related to the current item being discussed or wait until the open general public comment period. We will also allow a maximum of 3 minutes for each comment to keep us on schedule. Evan, would you like to provide some technical direction around that?
Yes, thank you. So members of the public who wish to comment on an item may do so when prompted. For those connected to the internet, through the internet, please take a moment to locate the raised hand icon on your screen. So in your Zoom meeting window, this will be used to signal that you wish to comment. For those joining by telephone only, you may press *9 to indicate that you would like to comment. You will then be called on. We'll call on comments in the order those hands go up, and you will have up to 3 minutes to make your comment.
And now I'm thrilled to introduce our co-chairs, starting with co-chair Secretary Castro Ramirez.
All right. Well, thank you, Julie, so much. And thank you, Evan, for providing the instructions. Gosh, we're here. As mentioned earlier by Secretary Galley, this has been, it's been a long time, right, to get us here. And I am thrilled to welcome all of the new members of the California Interagency Council on Homelessness, and to welcome back several of our continuing members. It's so great to see so many state agencies working together on this critical issue, addressing homelessness across the state. This is a testament to our collective state government approach and our commitment to developing a system that prevents and ends homelessness for thousands of Californians. I am so honored to co-chair this council with Health and Human Services Secretary, Dr. Mark Galley. It is quite a privilege, Dr. Galley, to be in your company. Thank you for everything that you continue to do for all of us across the state. As secretaries, we are resolute in working together to integrate health and housing into our state's homelessness response system with a person-centered approach. I would also like to thank our former council members, of course, for creating the foundation for this Interagency Council on Homelessness. Many thanks for leading the way and for developing the state's first comprehensive action plan to prevent and end homelessness in 2021 during this global health crisis. Because of their work and the engagement of so many stakeholders and people with lived experience who took the time to share their perspective and inform the action plan, this council has a roadmap to guide our collective and cross-agency work to address homelessness system-wide across the state. To all community partners, service providers, local leaders, advocates, and individuals that have joined us, and I see we have just over 240 people joining us today. Thank you. Thank you for being part of this first meeting. We need your continued presence. We need your engagement as we work to address this critical issue. And of course, many thanks to the legislature for their support, for their leadership and their partnership. I'm incredibly honored to join many of my colleagues across state government under the leadership of Governor Gavin Newsom to move forward the agenda and to double down on preventing and ending homelessness. I believe that homelessness is solvable. It requires that we improve collaboration and efficiency in a coordinated manner to address the root causes and to develop comprehensive and compassionate solutions. This council body relies heavily on director and secretary level membership. It adds 5 additional state departments, allowing us to move comprehensively, to consider the issues around homelessness, and to draw on the expertise from various departments and agencies. The council's day-to-day operations will be led by the executive officer, Julie Lowe, as has been introduced already, and a team of almost 50 staff members that will provide support to the statewide coordination and will continue to work with local community. As you all know, this administration has made historic investments in housing and homelessness. Just this past year, the governor approved and adopted by the legislature a historic budget that included $22 billion under the California Comeback Plan budget to address housing and homelessness. In the homelessness space alone, $12 billion was allocated to support transitional housing programs, flexible aid to cities and counties and continuums, encampment resolution grants, rapid rehousing programs, and programs to create permanent housing like the nationally recognized Home Key initiative that to date has funded almost 7,000 housing units. Again, thanks to our incredible governor, thanks to his tenacity and his leadership and his unwavering commitment to ensure that all Californians have a place to call home. Just 2 weeks ago, the governor released the California Blueprint budget, which directly confronts the state's crises of today, and it reaffirms his commitment to funding homelessness resources to rehouse unsheltered individuals. Specifically, it includes a set of proposed actions that integrate housing, human supports, and health services with an additional $2 billion investment to address homelessness, including $500 million to the ICH, to the California Interagency Council, to expand the Encampment Resolution Grant Program. These critical and substantive investments will be transformative. As we launch this Interagency Council, I hope that we lead the way by taking bold action, by being deliberative in identifying the strengths and the gaps in our system, by reviewing data to inform our decisions, by leading with equity and finding solutions to address the disparities in the homelessness system, and by developing practical and effective solutions to assist our homeless neighbors to move permanent, safe, and affordable housing forward. Now, it's my pleasure to welcome co-chair Dr. Mark Alley to our council. As health and homelessness are powerful, they're linked, right? You cannot sort of deny that there is a correlation between health and housing and homelessness. It is without a doubt that this is why you see the leadership that you see, right? The leadership of Secretary Galley leading the Health and Human Services Agency, and of course, BCSH leading our housing investments and strategy. And so with that, Secretary Galley, welcome. The floor is all yours. Thank you.
Thank you, Secretary Castro Ramirez. Lourdes, appreciate your just humble leadership and your real focus on what we're here to do. Let me also just thank Julie and Corinne on my team, tremendous leaders who are really moving mountains to make this a successful endeavor, allow us to really move the needle on an issue that is way long overdue. We stand on the shoulders and backs of people who've come before on this group before the council came together to really set a foundation that I think we will honor and move forward with a great deal of responsibility. I just also want to thank the new members the council for joining today. It's exciting for me to just see the breadth of folks who are coming together. Really big smile on my face with a lot of hope that we have the people who understand the money, understand the services, understand the development, and understand the problems in real ways across our state. And as my team likes to say, we're in the business of being silo busters. We want to be the chief silo busters. So as you're on this council, I see us all as responsible for busting silos and making a difference. I also just want to call out Cal HHS is in the House in a big way. 6 department leaders, Susan, JC is Medicaid director, Kim, Joe, Stephanie, and Tomas. Really just grateful to have 6 departments. And if there's ever a statement to say how linked the Health and Human Services are to the issue of homelessness, Lourdes, if you would let me, I would steal it and put it in our name. We would add an extra H into our name because it is so critical that we are part of this conversation and leading with solutions. And on the tremendous work of the efforts before us, I think we have real amazing opportunities. We have an opportunity to coordinate differently, to dream differently, to be innovators, to ask some hard questions about why we've never been able to do the thing that you all think would be the game changer and the real difference maker. And so I hope we use this forum to do that very publicly and challenge the concept of what's it going to take to not just be an interagency council on homelessness, but to end homelessness, to have that bold goal and say we can do it. I agree with Lourdes. Yeah, we can do a lot better than we have today as a state. And I think we've set the track record to be able to do that. The second thing I'm excited about is just the action plans and building on what we put in place, the ability and the opportunity to work with our local partners to put together plans that we challenge and push to make better. The same old solutions no longer. How do we make them a little bit more enriched, a little bit more broad, a little bit more focused on meeting the moment, as the governor likes to say, using data to drive these decisions, transparency, really pushing the envelope. And I think through the tremendous work, both on Front Street and in the back offices that people have done to get the data to make more sense and be more meaningful, we can not just set bold vision, but hold it to the data and the metrics, and frankly, hold all of us, including our local partners, accountable. And then the third piece, sort of picking up again on this notion of innovation, I'm just really proud of the departments from my agency that are here today and those that aren't, who all row in the direction of trying to make meaningful health and human services for people across California, but especially those who face struggles like no other, including incarceration, homelessness, those in the child welfare system, and another number of other very vulnerable Californians that, yes, we need to focus on all of us, but the truth is we have to lift some boats up a little bit more. And I see this as a council that is going to be focused on doing that. Vito, I see you and I see the work that you are there championing for the VA. Kathy, the work that you do, Kathy Allison, the work you do for people who experience incarceration for a period of their life, whether at the local or the state level, that we can make a difference. Stephanie, to called out state hospitals and the work that you do for people who face extreme and often undertreated, unserved behavioral health conditions, languish on the streets, but then through the services you provide, get some of their health back, but often don't leave with the kind of opportunities that we want to see them have. So I just want to really echo what Lourdes laid out as this tremendous opportunity to do something different here, to challenge ourselves with new tools, to expect more from one another and from the work that we do. The tremendous investment that the governor's really led with the legislature, $12 billion last year, $2 billion this year. The money is there. How we use it and the expectations we have out of it, I think, are for us to help create and support. I would be remiss if I didn't mention the amazing work at DHCS and CDSS as well. JC, you and Michelle, Kim, you and your whole team what you are doing to set up new opportunities on the brick and mortar side to create different types of reimbursement opportunities to deliver services for families, for individuals, the whole spectrum, I think is amazing. The work that's going to come together that this council should and will focus on with CalAIM, the home and community-based services efforts that we have laid out, really amazing opportunities. And Susan and Joe, as you guys come to this table representing important populations in California, those who experience disabilities and are dependent on some of the rehab services that Joe, you deliver, and Susan, your focus on the population of older Californians and those with disabilities in the master plan, which has as one of its primary pillars a focus on housing and indirectly homelessness. So I can't say enough about what an exciting day this is. As a clinician, as somebody who spent much of my career battling homelessness at the county level, creating important programs that I've been proud to be a part of, but they're just small slivers in the kind of solution that California needs and deserves to treat all of our citizens with the utmost integrity and dignity, and with anchored in equity. I'm just really proud to co-chair this. I'm really looking forward to it. And for all of my agency representatives, high hopes that we come with our A game and really contribute to this conversation in a meaningful way. So thanks, Lourdes. I'll turn it, I think, back to Julie. And I would just remind publicly that COVID is still with us. COVID is still with me on every single day. And I have the pleasure of 1:30 briefing that I cannot miss. So I will be off for a little bit and return shortly for the end of the council meeting. So thank you.
Thank you, Secretary Galley. And I'll turn next to Secretary Castro Ramirez to introduce her speakers.
Thank you so much, Julie, and completely agree, Dr. Galley. Here on high hopes for this council. Also, of course, want to acknowledge Corinne, as Secretary Galley mentioned. Corinne from Health and Human Services, along with Julie, over the last few months, have been working very closely with both Secretary Galley and myself to prepare for this meeting. And in preparing for this meeting, Secretary Galley and I felt that it would be very important and necessary to ground ourselves in knowledge on the critical topics in homelessness. We recognize that solving homelessness may often feel like it's too big, it's too daunting, it's too complicated to address. So the upcoming presentations will arm us with new knowledge and hopefully a deeper understanding of how homelessness relates to our work, and also provide us with examples and evidence on effective strategies that are being used to address homelessness. With that, I'd like to welcome our first speaker, Ann English, from the Corporation for Supportive Housing. I actually had the ability to work with Corporation for Supportive Housing many years ago when I worked for the LA City Housing Authority, and know of their work and very much admire and respect the work that they do to build local capacity, to work with local communities, to develop meaningful programs, right? And specifically, I just want to acknowledge that Ann English has managed many homeless services and housing programs at agencies, particularly in LA County, for more than 2 decades. She has a strong commitment and belief that behind every person lies a great story. So she has been very focused on lifting up the voices and the stories of people with lived experience. For those of you that are not familiar with the Corporation for Supportive Housing, it's an organization that provides a holistic approach to building local capacity that advances supportive housing solutions to end homelessness. So with that, I'd like to go ahead and turn it over to Ann.
Thank you so much. Good afternoon, council members and members of the public. Thanks so much for having me, and congratulations on the implementation of this council. That was a really wonderful and galvanizing opening. It felt really, I don't know, inspiring. So I'm very happy to be here. My name is Ann English. I'm a senior program manager with the Corporation for Supportive Housing. I'm based in Los Angeles, and I'm here to talk to you about some of the insights we've garnered over the past several years while working with individuals with a lived experience of homelessness, and about some of the potential opportunities and challenges for growing the impact of this work. Next slide. So just a quick overview. I didn't realize there was going to be some overview about CSH, but for the public and people that don't know us, CSH is a nationwide nonprofit community development finance institute, and we focus on solutions that essentially use housing as a platform for services to improve the lives of vulnerable folks and build really healthy communities. And our four main areas of work: lending, training and education, policy advocacy, and consulting and training. Through these areas of work, we offer capital, expertise, innovation, and in hopes of helping communities to use supportive housing to achieve stability and strength and success for people that are the most in need. Next slide. So we engage public systems to adopt supportive housing, shifting public resources. And as we know, systems change is an evolving and iterative process that can take years, but CSH is expert at coordinating change on a faster timeline. And we know that to best serve men, women, and families most in need, there must be a high degree of integration among service providers, property owners, managers, and the array of public agencies that fund these projects. We blend our experience and dedication with a practical spirit, always looking to uncover new ways to move forward, even in the most complex environment. And since 2013, CSH has begun to explore what I would say is a vast disconnect between efforts at the systems reform level and a lack of proximity to the people who are the ultimate beneficiaries of these systems. Next slide. So in 2013, the Speak Up program was launched with 21 individuals, formerly homeless individuals, 5 supportive housing providers, and 16 volunteer story coaches. And in 2014, the first cohort of 17 advocates completed the program and started what's now known as the Tenant Knowledge Exchange, an alumni community for those advocates to continue to be in community, to develop projects, to create trainings for service providers, and advocate at the local, state, and federal levels. Speak Up is essentially a year-long program. It's 10 months of programming, bookended by an orientation and a completion ceremony, and it pairs individuals with lived experience with volunteer coaches in the arts to learn together about housing and homelessness in Los Angeles, with a particular emphasis on social justice advocacy and trauma-informed storytelling. Advocates and coaches attend monthly workshops led by community leaders, and they meet one-on-one in between workshops to explore their personal narrative and to discover their own messages that they hope to convey. At the end of 2021, over 100 formerly homeless individuals have completed the Speak Up program. We've engaged over 50 volunteer story coaches and over 100 community leaders, stakeholders, and providers across LA County. Speak Up advocates are regularly solicited to provide technical assistance on consulting projects, education and advocacy focused speaking engagements, and they're recruited for community coalitions, nonprofit boards, and university and government projects. Over the past 8 years, as we've been doing this work, the Speak Up program has really afforded CSH the opportunity to partner directly with these individuals. And we've come to really appreciate that the level of insight to be gained from these relationships, far exceeds even our initial expectations. And in fact, is a required component of realizing the full promise and potential of our work. Next slide. So I love this quote because it perfectly captures the experience of awakening to an understanding about how we engage with those we seek to serve. We've learned through these relationships to actively and intentionally listen without assumptions and without preconceived ideas about the journey and the advocate's needs. You know, advocates and peers have been speaking out for decades, but our attention to their voices hasn't necessarily met the level of priority that's appropriate. Someone I know used to say that if we had been listening to people with lived experience of houselessness from the beginning, we would have embraced a housing first model much sooner. But it's really a cultural shift to fully value this expertise as we do professionals in the services industry. And our culture is rooted in a model that really assumes those impacted are merely recipients of services and only providers are the experts. And, you know, to be sure, many providers are working to reframe their models and include individuals with lived experience in really meaningful roles. And some folks are doing great work, looking at you, Jen Loving. Unfortunately, many are ad hoc efforts to meet a need without any plan of how to facilitate it. And, you know, these efforts represent a token acknowledgement rather than a true shift in approach. So, you know, an example is recruitment plans for nonprofit boards, you know, routinely don't include time to orient individuals on, you know, organizational structures, nonprofit governance, or, you know, connecting them with someone who can answer questions and ensuring that they're not like the only individual with lived experience on the board and expected to represent the entire community. So these are all things that we see as needing to be addressed as we move forward. Next slide. So in our ongoing discussions within the Tenant Knowledge Exchange, folks have highlighted a variety of both operational and systemic challenges in homeless services and housing. Many of these challenges mirror research findings, specifically from UCLA's Cal Policy Lab's recent report on inequity in permanent supportive housing in Los Angeles, as well as a recent article in Cal Matters, which Dr. Gelli's quoted in, describing key challenges which disrupt the system's capacity to meet the service needs of individuals. The Policy Lab's focus on returns to homelessness is especially significant as we undergo unprecedented efforts to develop and bring online more supportive housing. Among the members of the Tenant Knowledge Exchange, discussions often surface related to practices meant to provide community and support. With the best of intentions, overextended, undersupported, and underpaid staff are routinely susceptible to burnout, leading to high staff turnover. Consistency in case management support is necessary to building trusting relationships and overcoming the consequences of trauma, which lead to distrust and disengagement. Yet we have never met best practice standards of care when funding services. Speak Up advocates by and large acknowledge and express gratitude for their housing providers, but often they reveal that they do not have access to needed supports without incredible efforts to navigate complicated systems. And providers and working with providers who are equally in the dark about resources as they are. Access to information about resources and knowledge about the various programs, subsidies, and entitlements that they're enrolled in can provide clarity and assist tenants and programs to better navigate solutions. Next slide. So we're in an opportune moment with the passage of legislation to legitimize peer support workers as professionals. And there's increasing acknowledgement and support to integrate lived experience more fully within the sector. Peers have long been an underutilized asset in our sector, and when engaged, are sometimes deployed in ways that mirror an agency's usual practices rather than leveraging the unique assets of the peer approach. And what separates peers from other service providers is an innate understanding of the value of community and advocacy in the service of assisting the current and formerly unhoused. When providers are stretched thin, the addition of peer supports can provide invaluable capacity in ways not always obvious to providers. A greater investment in training organizations to understand and fully leverage the unique contribution a peer worker can offer and how to integrate this skill set is as important as training peer workers to provide services. Working as a peer is often a labor of love and a pathway to meaning and purpose, which affords healing and recovery. When these skills and efforts are undervalued or even dismissed, it feels like the entire enterprise is wasted. Increasing interest to include lived experience expertise is hopeful and much needed, and also full of opportunities for unintended consequences. At a minimum, token gestures fail to fully realize the benefits of engaging individuals with lived experience, and at worst, exploitation, which furthers marginalization and can lead to renewed distrust of the system. We have struggled with setting standards for our communities, engaging lived expertise, and we recognize this is going to be an ongoing challenge. But as you move forward with your work and implementation of your action plan, I hope you will consider that what we have heard over and over again is the need to provide more effective supports. A robust effort to identify the mechanisms for investing in services fully, services that focus on the approach of service delivery rather than the array of services that are delivered. Baseline case management standards, which recognize the critical importance of building relationships, consistency, and trust as a path toward thriving and true reintegration into our communities. Next slide. That is it for me. I hope that, unlike my esteemed colleagues who are speaking, my information is much more qualitative data, but it comes from years of working with folks and recognizing how important it is that we listen to them intentionally and provide the appropriate mechanisms to respond to what we are seeing. I think there's so much discussion that can happen, but I thank you again for your attention, and my contact information, it will be on the slide. Thanks so much.
And thank you so much. Great presentation. We are going to hold off on questions until the end of all three presentations. So next, our next speaker is Dr. Margot Kuchel, Director of UC San Francisco's Center for Vulnerable Populations, and also the Director of the Benioff Homeless and Housing Initiative. Dr. Kuchel is a professor of medicine and division chief of the vulnerable populations at the Zuckerberg San Francisco General Hospital and Trauma Center, just doing incredible work day in and day out, and also advancing incredible research. And so today we're pleased to have her here to share more about homelessness, health, and the state survey. Thank you.
Thank you so much for having me. I'm thrilled to be here. I'm going to try to cover a lot of ground in a short time, so please bear with me. And instead of bombarding you with facts, I wanted to actually provide a framework for how we think about the devastating association between poor health and homelessness. Next slide. So just to level set, it's really important to know that no matter what we say about health and homelessness, the fundamental driver of homelessness is the lack of affordable housing. What makes an area have a lot of homelessness or less homelessness is not about how much substance use or mental health in that community. It is about the discrepancy between the available of affordable housing and the need for it. I want to remind you that when we think about those at highest risk of homelessness, it is those extremely low income households, any household making less than 30% of the area median income. And that in California, we have a 1 million unit deficit of extremely low income housing, and that California fares the second worst in the nation on an important measure of this, which is that we have only 24 units of ELI housing for every 100 ELI households in our state. So with that in mind, next slide, I want to move to talking about the association between health and homelessness. The first thing I will say is that homelessness is the single most devastating thing that can happen to people's health, and that people who experience homelessness have dramatically worse health outcomes, not only than the general population, but than those in the poverty population for whom perhaps is the closest comparator. So why is this? The first thing is, undeniably, poor health is associated with becoming homeless. And that is for, I think, about a few main reasons. One is what I would call the shared risk factor issue. Historically excluded and oppressed populations, those who experience poverty, racism, gender and sexual minority discrimination, incarceration, adverse childhood experiences, and trauma, are both at risk for homelessness and at risk for poor health. So they have the shared risk factor. The second is that poor health, whether it be poor mental health or poor physical health, are associated with becoming homeless. They cause homelessness, or they cause sort of precipitate homelessness, I should say. When you have poor health, you're more likely to have a loss of income or inability to compete in the labor market, disruption of relationships, and other things that might precipitate homelessness. Finally, because this gets a lot of press and concern, I want to point out that addiction or substance use disorders has both of those issues, the association with homelessness through shared risk factors, things like adverse childhood experiences, trauma, incarceration contribute to the risk of having these disorders, and they directly contribute to homelessness. But unquestionably, having addiction can disrupt your social ties, your ability to compete in the labor market, therefore your housing. And if you have a substance use disorder, you are more likely to become homeless. Next slide. But perhaps more importantly, homelessness directly leads to poor health. We think of this for many reasons. The first is the environmental conditions of homelessness are exactly the opposite of what creates a healthful environment. We think of things like the spread of infectious diseases. We've seen that really clearly recently with the way that COVID has spread through homeless shelters. A few years ago in Southern California, we had a major hepatitis A outbreak in homeless encampments. But other things that get a little less attention, but I as a physician think about all the time, the incredible sleep deprivation associated with homelessness is a direct insult to health. The incredible trauma that people experience, unintentional injuries, victimization, exploitation, and then things like poor access to a healthy diet. So the environmental conditions of homelessness directly worsen health. But we also think about things like what we would call competing priorities or stress, which create negative coping behaviors and make it harder to exit those. So we know that people who are homeless have extraordinarily high prevalence of smoking. That is in part because it's really hard to quit. When your mind is out, where am I going to sleep? Where am I going to eat? You're not working with your healthcare provider to try to change your smoking. The same thing through substance use, where we see people's substance use increases when they become homeless as a coping mechanism. Engagement in risky sexual behaviors, often through survival sex or exchanging sex for money or a place to stay, and unsafe drug use. Next slide. Homelessness impedes people's access to the healthcare system and thus worsens their health. So people, when they're experiencing homeless, have very poor access to longitudinal health care, things like primary care, mental health care, or substance use treatment that can improve people's health. This is through many mechanisms, as you can imagine: lack of insurance, lack of transportation, no phones, no time to go, competing priorities. I'm waiting in line to get food. I'm not going to go to my doctor. And the intense stigma and mistrust in the healthcare system that people who are homeless experience. What we know is that when people are homeless, they have very poor adherence to medications for chronic conditions. One, they've got a lot better things, more important things to them to think about than are they going to take their blood pressure medicine to decrease, a heart attack 10 years out, but also things like the cost, medications getting lost or stolen. We know that people who are homeless have a very high use of our acute care systems, the emergency department, hospitals. This is partly because people are in poor health, they have high-risk behaviors, and they have lack access to non-acute care. They've got these comorbid conditions, they show up later, so that by the time they show up, they're sicker. And frankly, we have to change our admission thresholds. Many conditions that I can very easily treat on an outpatient basis and someone who has a home, I have no choice but to admit them to the hospital when they're homeless. Once patients are admitted, they have prolonged hospitalizations and extraordinarily high readmission rates. They also have an over-reliance on the most costly forms of healthcare, institutional care, things like nursing home care. Next slide. I want to point out to you one of what I think is in some ways the oncoming train of homelessness, which is that the homeless population is aging. Now between 1/3 and 1/2 of single adults who experience homelessness are 50 and older, with our fastest rising group are those 65 and older. And we have shown through our research that homeless adults in their 50s and 60s have health conditions worse than those of housed individuals 20 years older. Next slide. People who are homeless have poor outcomes in every way, whether it be their health outcomes, elevated use of the emergency department and inpatient hospitalizations, extraordinarily high readmissions to hospitals, prolonged admissions, and perhaps, most strikingly, extraordinarily high mortality rates. Homeless people under the age of 45 die at approximately 9 times the expected rates, with leading causes of death being substance use, infections, and violence. And homeless people 45 and older die at 4 to 5 times the rate we would expect them to, with the leading cause of death, cancer, heart disease, and substance use. Cancer and heart disease, the same leading cause of deaths in Americans. People who are homeless experience those deaths from those same causes 20 to 25 years earlier. Next slide. There is a bidirectional relationship, therefore, between poor health and homelessness. Poor health contributes to their individual's risk of homelessness, but homelessness directly worsens health. People who are homeless have chaotic use of the healthcare system, and that use is associated with worse outcomes. And frankly, the care that we provide is both costly and ineffective. This leads me as a physician to say there is no medicine as powerful as housing. Next slide. I just want to say we should not give up hope. And I know that Ann English talked about this, and I'm sure Carolina Reid will also. We know what works to end homelessness. Just a reminder, once and for all, we have incontrovertible evidence, which I am happy to review with you at any time, that housing first works. And this is how I think about this. Everybody needs housing they can afford. Some people need voluntary supportive services which function as the disability accommodation to help them thrive in that housing. And we have shown that even the people with the highest risk behavioral health needs can be successfully and long-term housed using supportive housing. Supportive housing, subsidized housing with voluntary supportive services always offered on a housing first basis. If you require the services as a condition of housing, people will not come into housing. If you, however, house people, bring them in and offer those services in a low barrier way, people take you up on those offers, take those services and remain housed. As people age, we need to think about, how to adapt our housing for an older population who may not be as old chronologically, but are as old in terms of their, how they really are. And then I want to remind you that for many, many people who are living in our encampments and our streets, they really just need housing that they can afford. They don't even need all of the services. They just need that housing that they can afford. Next slide. So Corinne asked me to speak about the state survey that the BHHI is conducting, just to give you a sense of what you can expect from it over the next few months to a year. Next slide. The statewide survey is what it sounds like, a survey of homeless people, homeless adults statewide, to look at the characteristics of adults experiencing homelessness in California, with a focus on questions about what are the immediate precipitants of homelessness in order to inform what were missed opportunities for prevention, to look at the impact of the COVID-19 pandemic on homelessness, barriers to housing exits, and experiences while homeless. Next slide. This was requested by Secretary Ghali. We are using mixed methods, so both surveys and in-depth interviews, and we are really creating it in order to drive policy. We are trying to get you the answers that you need to make the best policy decisions you can. Next slide. Our study is being really very much impacted and guided by our community engaged practices. We have 3 community advisory boards who play an important role in every aspect of the study. Perhaps our most important one is our lived expertise board, being guided by people with lived expertise of homelessness. We've got a programmatic and policy advisor board and what we call a learning community just to help us run the study. These boards are giving us input on sampling, data collection, interpretation, and dissemination. Next slide. We are in 8 counties, which we selected in order to be representative of California as a whole. At the end, we're going to be able to say, this is what California looks like. We are in urban areas, rural, coastal, inland, northern, southern, some with very high rates of homelessness, some with low rates. This was intentional. In each county, we are serving between about 300 and 700 to 900 people that we are selecting using very sophisticated methods to be representative of the population of adults experiencing homelessness. We use some sampling frames, including venue-based, so we're going to shelters, encampments, free and low-cost food lines, recycling centers, et cetera. And then to reach those populations that normally get left out of these things, we're using something called responsive driven sampling to find people who might be harder to find, people who are hiding because they're survivors of interpersonal violence, day laborers who may not have documented status, et cetera. In every county, our work is being guided by local experts. These experts accompany us. They're usually experts with themselves, lived experience. We are conducting interviews in English and Spanish and have interpreters for other languages. Next slide. We are looking at a variety of domains, demographics, duration and characteristics of homelessness, precipitants, mental and physical health, substance use behaviors, barriers to rehousing, interactions with the criminal justice system, healthcare, mental health and social service utilization, and experiences of discrimination and trauma. Next slide. And we are enhancing this survey data with what we call qualitative research, where we are really turning on the microphone and asking people open-ended questions to really get at the why and the how, as opposed to just the numbers. We are looking at studies we are doing on the immediate precipitants to homelessness, what happened to people right before they became homeless, what would have helped them, barriers to housing exits, like what is keeping them from being housed, experience of those with significant mental health and substance use disabilities and what their experience is like, how interpersonal violence plays a role, the experience of Black Californians and the experience of Latinx Californians experiencing homelessness, and those with recent incarceration. We really are zeroing in on these questions to get a deeper dive to understand. Next slide. The study is ongoing. We've had some pandemic-related delays, but my teams are in the field around the state. We plan to complete data collection, COVID permitting, by mid to late fall in 2022, and we plan to release interim data analyses and reports. Next slide. And with that, here's my contact information, and I look forward to our discussion after Dr. Reid's talk.
Thank you so much, Dr. Kushel. What a great presentation. The last 2 presentations, just amazing. I'm sure our council members are wanting to chime in and ask questions. We're going to get to the last presenter. So next up is Carolina Reid. Carolina Reid is a faculty research advisor at the Turner Center for Housing Innovation at UC Berkeley. She is also a Donald Turner Distinguished Professor in Affordable Housing and Urban Policy in the Department of City and Regional Planning at UC Berkeley. Her work focuses on housing and community development, especially as it relates to access to credit, mortgage markets, urban poverty, and racial inequality. And today we're happy to have Carolina join us to learn more about homelessness and housing affordability.
Thank you so much, Secretary Castro Ramirez. It is a delight to be here. Thank you so much for inviting me. And also a big thank you to everyone at the council and at all the state agencies for the work that you're doing to address homelessness across the state. It is truly a big task, but an important one. And I agree with Anne that the shared vision you're putting forward with this council is really inspiring. So very excited with what you're all doing. In my remarks, I'm going to build on Anne and Margot's presentations and focus a little bit more on the structural and upstream factors that are contributing to California's homelessness crisis. The reality is that for every person that we successfully help find housing, approximately 3 new individuals become unhoused. In any given year, 2/3 of unsheltered adults are experiencing homelessness for the first time. And it's important to recognize that it is this inflow of new individuals into homelessness, often seniors and people of color, that poses the biggest challenge to our efforts to end homelessness in the state. Next slide, please. While the individual causes of homelessness are really complex and multifaceted, the lack of housing affordability is central to housing insecurity and greatly heightens the risk that a person becomes unhoused. 60% of people experiencing homelessness list economic hardship as the primary reason they are unhoused. And I think, as Margot said so eloquently, studies have consistently demonstrated the link between high housing costs and high rent burdens and high rates of homelessness in a community. So while it's very difficult to predict at the individual level who becomes unhoused, we know that cities and counties with greater affordability challenges are going to see higher rates of homelessness. And again, as Margot mentioned, the risks are especially high for extremely low-income families, who we define as those earning less than 30% of the median income in the county in which they live, which we also refer to as AMI. Next slide. So in 2019, so prior to COVID, which we expect has made the situation worse, California had over 2.2 million extremely low-income households. Not all of these households are going to face economic hardship. About 30% are homeowners. These tend to be older, non-Hispanic white households who own their home outright and who are income poor, but they're asset rich. And we know that they are unlikely to face housing insecurity over their lifetime. However, over 1.6 million ELI households are renters. Their average annual income is approximately $15,000. A disproportionate share are seniors living on fixed incomes. As Margot shared, the aging of the homeless population has very important implications for health, and these seniors are particularly vulnerable, especially in markets where rents keep rising. The ELI population faces other structural vulnerabilities as well. They're more likely to be disabled, they're more likely to not speak English well, and they're less likely to have a high school degree than the population as a whole. I also really want to emphasize that almost half of ELI working age adults at greatest risk of homelessness are employed, and they're working in jobs that provide critical services, from health and social service workers to food service to custodial work. I don't think I can emphasize this point strongly enough, particularly given the tendency to assume poor households are welfare dependent. In fact, as a country, we provide very little welfare assistance or any kind of assistance to these households. And even more so, we provide almost no housing assistance to those who need it. Less than 20% of ELI renter households receive any kind of help to pay for housing, like a voucher or a unit in public housing. The rest, an estimated 1.3 million households, are those we are most concerned about when it comes to housing insecurity and homelessness. Next slide, please. Systemic racism across multiple domains, including housing and labor markets, mean that Black and Hispanic Californians are overrepresented among ELI renter households most at risk of housing insecurity. Almost 1 in 3 Black renters in the state, 32%, live in an ELI household. This is almost double the rate than for non-Hispanic white households. Native American and Asian Pacific Islander populations are also more likely to be extremely low income. Next slide, please. Not surprisingly, given the state's high housing costs, 85% of ELI renter households are cost burdened, meaning that they spend more than 30% of their income on rent, while 70% are severely cost burdened, spending more than half of their income on housing. Again, re-echoing, I don't think we can echo this enough, but echoing Margot's points earlier, studies have shown a direct link between these high housing cost burdens for low-income families and the risk of eviction, displacement, and homelessness. Next slide. Interviews with extremely low-income individuals point to a vicious cycle of financial precarity. Their rents are higher than they can reasonably pay. The yellow bar shows how much would be considered quote unquote affordable to an ELI household in different markets across the state. The gray bar is how much they actually pay. But if they are evicted, for example, due to an income or health shock, think about COVID, that affects their ability to pay rent, they face significant challenges finding a lower cost unit in the market. The blue bar shows fair market rents in each metro, providing an indication of the size of the gap households face in finding affordable housing. Every move leads to greater housing costs, greater housing instability, and greater financial stress. The high cost of housing in California also increases the challenge of providing housing assistance. That gap between the yellow bar and the blue bar keeps getting bigger, which means that the gap that public dollars need to close between what a family can afford and market rents is growing larger, limiting how far available subsidies go. This is especially problematic as the funds for housing vouchers from the federal government are not growing in tandem with need. Next slide. The high cost of building housing is another important factor. California has become one of the most expensive places to build new housing, averaging upwards of $500,000 for a typical new unit. This is true for market housing as well, not just affordable. There are a lot of factors driving up these costs, land values and labor costs chief among them, but also fees, local zoning requirements such as parking, delays in permitting and approvals, and building codes. Permanent supportive housing, due to its higher operating costs and building requirements, tends to be more expensive to develop than other forms of affordable housing. There are things we know would help to lower the costs of developing affordable housing. But it is also important to emphasize that we shouldn't swing the pendulum so far in the direction of cost efficiencies that we start to underfund what it actually costs to build and operate affordable housing. We need to make the necessary investments now because the long-term costs of not doing so are going to be much greater. Especially in the state's higher cost markets like LA and the Bay Area, we have to acknowledge it will cost more to build units as well as provide needed services. As Anne highlighted in her presentation, we can't effectively address the problem with underfunded programs and poorly paid staff. And as Margot highlighted, we know what works, and we know that housing works, and we know that housing first works. We just need to fund and deliver it. Next slide. Unfortunately, the combination of a large number of low-wage workers that increase demand for affordable housing, insufficient public subsidies, and the high cost of development all translate into a significant shortfall in the number of affordable housing units across the state. This state shows the gap in the number of affordable units built during the last Regional House Needs Allocation, or RHNA cycle. For those of you unfamiliar with RHNA, it refers to the housing targets that jurisdictions need to plan for to meet the needs of households at different income levels. The impact of insufficient subsidies to build affordable housing, as well as NIMBYism at the local level, means that jurisdictions consistently underbuild the number of affordable housing units that we need. Next slide. The good news, and I'm excited to be able to share so much good news, is that there's significant progress to build on. Importantly, the state has undertaken unprecedented housing and land use reforms in recent years. These efforts, and I'm going to name some bill numbers, are AB 72, SB 35, and SB 9. Don't need to memorize all those numbers, but they've really increased accountability under the RHNA process and housing element process, meaning that cities need to be accountable to building housing to meet the needs of the people who live there. They've streamlined the approval process for affordable housing, making it easier to get it built. And they provide a legal framework to increase how much housing can be built, especially in single-family zoned areas. We also see an expansion of resources for affordable housing. And I think Secretary Castro Ramirez and others have said, the unprecedented funding commitments that have been made by the state in these areas. California's commitment to programs such as HomeKey and HAP, as well as the new CalAIM initiative, are critical investments in addressing homelessness across the state. I'll also echo Dr. Ghali and Secretary Castro Ramirez about the importance of this council and its role in, I think what he said is silo busting and increasing the coordination of efforts across the state. We know that that lack of coordination limits our effectiveness. Quickly, the Biden administration has consistently signaled its support for expanded funding for affordable housing. Build Back Better would have been amazing, but hopefully there will be a renewed push to pass a social spending this bill that would actually expand the number of vouchers available in California. And finally, but certainly not least, foundations in California are also investing in innovative pilots and providing important funding support, especially in the state's coastal markets, that are leading us to understand better what works and how to deliver that. Next slide, please. That doesn't mean that the path forward is going to be easy. One of the biggest challenges is ongoing resistance to building new housing, especially for multifamily apartments, affordable and permanent supportive housing. High development costs, which have been worsened by the pandemic, coupled with insufficient and poorly aligned funding streams, continue to challenge the affordable housing field, as do geographic differences across the state in costs, funding, and capacity. One of the biggest gaps remains sufficient operating funds for PSH properties. It's also not just a housing problem. Widening income inequality contributes to and exacerbates the housing crisis. And we know that the long-term economic and health impacts of COVID-19 are falling on the most structurally vulnerable households. There's widespread concern that the 2022 point-in-time counts will show a dramatic increase in the number of unhoused individuals, despite government efforts to provide financial aid and shelter. In conclusion, solving homelessness is going to require that we address not only the immediate crisis of those who are currently unhoused, but also that we address the structural factors that push new individuals and families into homelessness. Thank you. I look forward to your questions.
Thank you so much, Carolina. Thank you to you, to Anne and to Margot. Great presentations and just a wonderful way of kicking off this inaugural Interagency Council on Homelessness meeting. We do have time set aside for questions and discussion. And so I am going to go ahead and open the floor. And before we see hands raised, that's great. Thank you so much, Jennifer. Let me just ask Julie to chime in here. She was going to introduce a council member who's just joined us.
Sure thing. And before we move to the discussion and questions period, I'd like to announce a staff member from the Department of Education, Carmina Barales, has joined to participate in discussion on the department's behalf. Welcome, Carmina.
Fantastic. Thank you, Julie. Okay, Jennifer, I see your hand up.
Thanks to all three presenters for always being so smart and on point. And, you know, one of the, as we are all facing rising, I think, a lot of homelessness disinformation, kind of a rush to have some sort of easy answer to this long boiling crisis that we have. Each of the presenters makes the really valid point about the need for prevention. Prevention in the form of subsidies, in the form of affordability, in the form of keeping people from losing their homes. There'll be a lot of effort to address encampments, which there should be. There'll be a lot of people that will be moved into home key housing. Lots of other types of housing are being developed around the Bay, but we'll still have that 2-to-1, 3-to-1 average that we're contending with, where it will only feel like the problem is not mitigating, because we have to also focus so much on keeping people from losing their homes. And there was that wholesale effort that happened through the pandemic with rent relief. In our community, we saw a decrease of people becoming homeless for the first time in years in 2020. But now that those protections have expired, access to money is not what it was, right? Who knows what we will be seeing going forward. And so I think the tools that we can do as a state, or prioritizations that we can place on not only the extremely low income affordability, but keeping people housed is, I mean, it's just critical. So thank you all for your good work.
Okay, Councilmember Allison.
Hello, thank you so much. Those are wonderful presentations, and it's exciting to hear the conversation around this space. I actually had two questions. One was, and maybe it was just the graphs, you were focusing on the more populated areas. What about our rural communities? It's still impacted there. And then, maybe this is a naive question. As builders are anxiously building around the state, can we force their hand? And I think we can, that they have so many, they get a permit for, let's say, X number of houses that they have to build, X number of low income. And then what does that low income mean? Because I've seen them in communities where they think 500,000 or 600,000 is low income. There's no way that's low income from, you know, my personal family experience of what really low income is. So I'm just kind of throwing that out for conversation.
Secretary Castro Ramirez, do you want us just to take questions and jump in when we feel, or do you want to collect questions?
Please jump in, Carolina.
So I think those are two terrific questions. I think on the first, the rural areas are struggling with similar problems, and they are also struggling with less capacity in terms of housing development and providing services, and right, like that whole infrastructure to support both people who are unhoused as well as lower income families is just less prevalent there. So I think absolutely the problems are significant in rural areas, and I think that's one area where I know less, so maybe Margot can jump in too around that. About this question about building affordable. So when we see a market rate development, we can include inclusionary requirements that require that they build a certain % of units to be affordable to lower income families. The problem with extremely low income families, so the families that you have experience with, those that are making $15,000, $17,000, the cost of building and operating and sustaining those units is not going to be possible through private market functions alone. We need public subsidy to sort of close that development cost gap. Now, there are some initiatives. Los Angeles has done a good job in its transit-oriented communities program of helping to sort of facilitate some ELI units, so those at 30% and below, but it's very expensive to the developer, so you're not going to get as many units as you need. So to get to those very deeply affordable levels, there almost always needs to be some kind of public subsidy also layered in.
And I think in terms of the rural communities, thank you for asking that question, because I think these communities often get sort of alighted. I can say a few things. One thing is as housing costs increase statewide, we're seeing this creep, right? It goes from, like, you know, the Bay Area has, like, a lot of people are commuting from the exurbs. So we've seen these increasing housing costs going deeper into rural communities. The other thing I want to really uplift is the role that wildfires and natural disasters have played. It is not like a tangential thing. It is a major driver of homelessness in our rural communities. And I think 100% of the rural communities face many of the same things, but they also face additional challenges, things like transportation and the lack of public transportation to get people not only to services, but to jobs. We've been in rural communities in our state survey, and we're finding people who got a job but have no way to get there, and people really not having any way to get into shelter, food, or other things because of transportation barriers.
Thank you. We'll go to Councilmember Johnson.
Thank you. I also just want to appreciate the presentations across the board from all three speakers, and just want to say I really appreciate and uplift that as government, we must embed the voice of those that we are serving in everything we do, program design and policy making, and appreciate that being highlighted and lifted up in this space. I'm interested in the presentations. Each of you, I was paying particular attention to the language you used, and especially thinking about that in the context of, I believe, what Carolina, you referenced as the resistance to getting additional affordable housing and supports being built. And that's part of the challenge, also obviously rooted in historical racism and other components there. So I'm interested from each of you or any of you, any recommendations you have to us around successes you've seen where communities have transformed, have changed, have shifted from the kind of NIMBYism. And Dr. Cashel, you certainly highlighted and simplified some of the issues, the stigma, taking away some of the stigma very quickly there, and really appreciate you lifting that up. So that's my question to any of the speakers. Any successes you've seen or recommendations you have in that space, kind of getting from where we are in some communities to where we need to be, especially as it relates to having more affordable housing.
So I definitely feel like there's a huge piece of around advocacy through lived experience, persuasive storytelling, and that is what I have seen impact communities. And it's not like it's, you know, a magic bullet or anything like that. But what I will say is when people are not, you know, necessarily paying attention, I mean, I can just tell you a little story about one of our volunteer story coaches. You know, in his regular life, he's like a, I don't know, a financial advisor or something, but does competitive public speaking. And he was so inspired by working with the advocates that he ran for his neighborhood council, which was in a very, very NIMBY region. And just through perseverance and continually bringing information and exposing people to stories, like the tenor of that council shifted. And it happened over time. But really, I think kind of there are some times, everybody I know knows this to some degree, when just continuing to bombard people with, you know, the data, we know this is what works, we know this is what's right, et cetera, people for whatever reason don't connect to it. But if they see someone that for whatever reason they connect to on a human level, something else, there's that opportunity and opening of the mind to think differently. So that's my contribution.
I just want to also say, right, like we focus so much as the population of people experiencing homelessness as somehow some separate population, but by this point, and this is totally a guess, and Margot's going to be like, how can you come up statistically with like numbers that don't really mean real numbers, but probably 1 in 5, 1 in 4 people in California have experienced homelessness at some point, right? Like it is much more ubiquitous. And I see it with my graduate students at UC Berkeley. Many of them have had lived experience of homelessness. And so we need to start seeing them as just us.
I also think, though, it's worth uplifting a little bit the elephant in the room. In this recent LA survey, I thought was very indicative that Black and Brown Californians are not only, you know, Black Californians are, you know, nationwide, Black folks are 3 to 4 times more likely to become homeless. The statistics, at least in the major metropolitan areas in California, look devastatingly even worse than that, like 5 to 6 times. That is, and we can, you know, talk about all the ways that structural racism has led to that. But then you see this difference, right? Where Black folks are much more likely to say they know somebody who's homeless than white folks do. And then people's attitudes towards the causes of homelessness. Black folks identify the causes as structural, I would say correctly, and white folks blame individual stigmatized conditions. I think that we need to not be naive when we talk about the sort of counter forces and what's going on when people try to blame individual stigmatized conditions as opposed to structural conditions. And I just want to name the sort of racialized aspect of that goes into that.
Thank you so much for that. Okay, Councilmember Johnson Hall.
Yes,
There you go.
I
Thanks.
also just want to echo thanks, a big thanks for the knowledge that each of you have shared today. I think when I think about lived experience, I think about making it personal. And each of you have shown today your passion and your personal commitment to this, which I think in and of itself is a learning tool for me. So I thank you. Carolina, I was really, as a housing advocate, I was really focused on your presentation, and especially as it leads to the conversation around building new affordable housing. I'm wondering if you all have also done any work around the preservation of existing housing, and what you have found as that being a tool, if that is also could be an effective tool in addressing this challenge of homelessness.
Absolutely. And I think there's multiple approaches to that preservation, right? There's the importance of preserving existing affordable housing, so existing subsidized housing, and making sure that affordability covenants on those units don't expire. There is the preservation of units that are in the market that are lower cost, but that often when they get flipped, get sort of pushed up to higher costs, and we lose that affordability. So I think there's ways of sort of preserving that affordability by making sure that people stay in their units, right? And making sure that they can sustain those units. I think the challenge on preservation has been that we haven't had enough tools to do that effectively. We don't have as many funding streams that focus on preservation, and the ability of the public and nonprofit sector to compete with private market actors during that flipping process is actually quite difficult. And so those have been the barriers to really expanding our preservation strategy. I think some of the work around tenants' opportunity to purchase acts that are happening across the state, and some of the funding that the state has put towards that are exciting new models that are worth studying and investing more in.
Okay, we'll go to Councilmember Xavier.
Yeah, thank you. Like everyone else, just really appreciate the depth and scope of information that you have shared. As I'm processing all of this, and want to go both upstream on the preventative and then ask a little bit about the elimination. On the preventative side, I heard a bit of conversation about how housing is leading to homelessness. What can you share with us about the loss of employment as a factor in homelessness, leading to housing, leading to homelessness? On the elimination side of that, is there any information that you can share on individuals who are now homeless needing to get back into the employment market at a family sustaining wage, so that in fact, they don't just become housed, but they can stay housed?
Yeah, I mean, maybe I'll start and then pass it to, I think there are a few things. So thank you for that really important point. I think when we talk about housing, it really is a housing income mismatch, and that you know, if people got paid a lot more, then that they could sustain a higher housing cost. We know as an immediate precipitant to homelessness, one of the reasons that people become homeless, it is often because of a job loss of theirs or somebody in their households. There are many, many people who the whole household is dependent on everyone pitching in, and often just one person losing that job can really precipitate sort of it being down. And I think that, Caroline and I are both involved in All Home, which is sort of a regional effort to end homelessness in the 9-county Bay Area region. And we've been talking a lot about needing to sort of uplift not only the housing side, which we all feel passionate about, but the economic development, occupation side, making sure that jobs, not only that people get into the job market, but frankly, that they pay enough to sustain housing. And I think that's one of the reasons why we also keep pushing on housing, though, because like the housing wage in our high cost regions of California is just extraordinarily high. And there's really not a clear way often to pathways for job prospects that pay enough to cover the exorbitant costs of housing.
Okay, we'll go to Councilmember Demoris.
Yes, thank you. And thank you to the three presenters. Those presentations really built very well off of each other and a great grounding, especially in my first meeting. I wanted to ask Dr. Kushel about the study that's about to begin, and you had identified special populations that would be examined. And I didn't see older adults as one of those subpopulations, although they were mentioned as the fastest growing subgroup. Can you speak a little bit to that?
So I don't know if you know, this is sort of my personal passion, and I have an ongoing sort of large NIH funded study that hopefully the NIH Council will decide today if it will go into the 11th through 15th year. I'm studying this issue of older homeless adults and death. We are definitely not including them, and we'll be looking carefully at them. And we have some age specific questions that we're looking at, things like function and other things, because we think that those are really important aspects of homelessness, and those will be cross-cutting through everything that we do. So we're going to be able to look discreetly at the older population, which when we talk about homelessness, I really think that the key number here is 50. We often think of aging as 65 or older. Frankly, people living in deep poverty don't often live to that age. And as I said, they have those age-related conditions that start in their 50s and 60s. And so we will be subdividing everything that we look at by age, with paying particular attention to this older age group, both if their precipitants differ, if their experience differs, what their barriers they face, and really what their needs are.
Great. I knew you wouldn't neglect that topic because you're an expert, a national expert on it. And the precipitating factors too, with the bar graph around income equality, and certainly older adults who are on a fixed income, how that bar graph, in Carolina's presentation. I just wanted to lift up Serving Seniors out of San Diego produced a great report in the fall. And one of their findings was often, for a majority of the respondents, the difference was $300 a month. And I'll share that report in the chat, but that bore out definitely in that bar graph. Thank you.
Thank you. Okay, Councilmember Cooper.
Thank you. Good afternoon, and agreed. The presentations today were really great and very insightful. A quick question, thinking a little bit more on the upstream prevention. When you have kind of this affordable housing crisis and many of the facts that you guys have walked us through, supply and demand issues essentially at their core, how do we balance the diversion in preventing homelessness aspects of the pieces? Any policy recommendations? I think we're trying to do a lot of thinking about how do you get upstream, right? How do we not only handle the clear, very large issue of people currently experiencing homelessness, but if we're trying to balance these two things, what are your recommendations on thought or policy we should be thinking about that could inform or help some of that work?
So I think I would break it down into one, we do need to become a state that really does prioritize housing, right? And building housing, and I think affordable housing is particularly important, but part of the challenge is also that we're not building enough market rate housing or middle housing targeted at middle income families. And so we're getting sort of pressure throughout the supply chain. So I think housing is certainly important. I think the pandemic, and I think somebody said this about maybe San Mateo, but I think the pandemic also showed the value of financial relief and emergency payments, right? When we give households a amount of money that they need, they are going to put it towards basic necessities like their rent, like food, like other basic needs. And so we can deliver that kind of housing assistance. There just needs to be sort of the political and will and resources to do that.
I also think we think about sort of globally prevention, right? Increasing the housing stock, providing vouchers, economic development, and then this sort of individualized targeting. And we know a lot about who's most likely among a lot of people who are at risk for homelessness to become homeless. You know, the single biggest predictor is ever having been homeless before. That is, you know, we should be looking for those folks and identifying them early. Living in a high area deprivation index census tract, turns out that those are the folks, you know, who actually become homeless, probably because of sort of structural factors, racism and others that have led to those networks being deprived, right? If you have a homeowner in your extended network, they're much more able to protect you from homelessness than renters who are struggling themselves to pay their rent. So I think we need to be thinking people leaving incarceration or other institutional care is like the other big group, or young adults exiting the child welfare system. Like there are also these, like within the general risk factors, there are these well-known individual risk factors that allow us to look for people and get the resources to them. And Jen, you know, in Santa Clara has found that they've just been able to really target homelessness prevention, and it's effective.
Thank you. I think as DHCS continues to build out our community supports and some of those effective pieces, I would love to chat with some of you offline around how do we make effective connections through some of those areas. So really appreciate your comments today.
Okay, great. Well, I see a few more hands going up. I think we're going to allow for maybe another 5 minutes of Q&A because I want to be respectful of the time of our presenters. So we'll go to Council Member Duran O'Shaughnessy, and then we'll go to Council Member Morales, Council Member Becerra, and then we'll wrap it up with Council Member Imbasciani. Vito, great.
Thank you, Secretary. Thank you to all the presenters. Super informative. Just to provide a little bit of a background, right? So I serve our community college system, right? Currently, we have about 1.8 students that are enrolled in our system. And prior to the pandemic, we have 60% of the students reporting housing insecurity. And we have 19% of our students reporting facing homelessness. And that's pre-pandemic data, right? So we know for a fact that those numbers are exacerbated and then inequity obviously exists along these lines around, with racial and other economic lines. So what we're really thinking about is, when we talk about prevention of homelessness, what are some kind of strategies around addressing housing insecurities, right? We know a lot of our students, if they are facing housing insecurity and homelessness, they are unlikely to persist. So they leave our system. And we know how important college degree does to one's social and economic mobility. So really this piece around prevention and upstream approach is something that we really want to tap into this network to really think about, right? The presenters obviously highlighted those high risk populations, and we have some students that will fit into that population description, but I think likely that many of them do not. So what are some of those, I'm just kind of putting the question out there, if there are any insights that you all can share to kind of help us think about that. So this is kind of question number one. And the question number two really is around the housing first approach, right? So we, as a system, did receive funding to create student housing really around affordability, right? But our funding has to be targeted to advance student success. So for us, that completion time is going to be a limiting factor. So how do we implement housing first model infidelity while recognizing our system's limitation in this housing space?
Yeah, I mean, I want to say, you know, Anne pointed out, you know, that we need to, when we're thinking about homelessness prevention, one of the most important things we do is the people who we've just housed, keep them housed. And, you know, in our study of older homeless adults, about 80% got housed over the course of the study, but half of them fell back into homelessness in a median time of a year. But I think that's where we're talking about using these, you know, without unlimited resources. You really want to target it to the people who are at highest risk. And I think when you talk about students in community colleges, that's like a really great example of making an investment that's going to pay off, right? If you can temporize, if you can provide a subsidy to keep those at very highest risk of homelessness in school and housed, then they are actually ones who are likely going to be able to use that degree to better compete in, you know, in the job market and increase their income. But I think, you know, there is really good data again on when we're trying to do prevention and targeting. And I just recommend that if we're doing prevention programs, we really adhere to those data-driven models, because sometimes I hear people say they did a homelessness prevention program and nobody became homeless. And my thought is you're probably not targeting the right people, because a lot of people who look like they're going to become homeless don't. And so there really are these evidence-based ways. And again, as I said, the single biggest predictor is having been homeless before. So if I had a limited number of prevention dollars, that would be and I had one question to ask, that would be the question that I asked: paying more than 50% of your income in rent, and then having been homeless before. That combination is you know, really where you probably want to start targeting.
All right, Councilmember Barreles.
Well, first of all, what an honor to be considered a council member, but I'm only here acting for our department, for my administrator, Mindy Parsons. I believe I was picked, though, to be here, not only to hear all these wonderful presentations and the very exciting work that's happening. I want to thank Anne for reminding us to put a face to the story, to rely on the lived experience. I know in education and for our programs, that's number one, that, you know, we need to listen to youth who have lived these things and lift up their voices, not only because they're young and they can make an impact, but also because they lived it. So maybe that could be one of your considerations. Dr. Cashel, I know it just popped into my mind when you were talking about community agencies. We do have a lot of youth-based organizations and advisory groups throughout different counties. That would be really, really great opportunities to get some of their lived experience from young people. I also wanted to say how great it was to hear about some of the health correlations related to what happens to our young children, you know, even young adults and older adults through their homelessness, and what the real health trauma is through that. I was hoping too that you could, you know, it was great to piggyback off of Rebecca, and I'll just call you Rebecca because I don't want to butcher your last name. No disrespect. I think I just want to remind everyone that in education, in order to find students eligible, we do consider what HUD calls at risk. Our definitions differ, and that makes it really difficult to unify our work. Some of our students and families who are doubled up due to economic hardship, those are considered at risk. Our families and young children who live in hotels, motels, and transitional shelters. That is not an ideal space for a child, a student attempting to reach academic success and access. Yet as schools and educators, we attempt to identify and serve those children and those families. We know that there is no stability like having a home and what that means versus a shelter, a transitional shelter, or a motel. We worked really, really extra hard during COVID to help educate and share that message. And we had some really wonderful partnerships come out of such really difficult times. So I would love to connect offline as well and, maybe help form some of what those questions are, or, spread the asking and get more from your study and your statewide work. Thank you.
Thank you. I love that. Please just reach out.
Great. Elisa,
Thank
representing
you.
Councilmember Omishakan.
Yeah, thank you. I just first wanted to say, listening to all the presenters, I'm just blown away, and my brain is racing with all sorts of ideas and realizations. I think what stands out most for me is housing is medicine, the best medicine. Certainly, it really is. And what I wanted to just bring up, and I'll say this really quickly, it's more of a statement, an observation, if you will, when we talk about prevention and housing availability, and we looked at the graphs about, some of the areas like the Bay Area or Southern California, where housing prices are crazy. They're just crazy, even for, a middle-class working family. But what has happened during the pandemic with people teleworking, what I've seen even in my community is even way out rural communities that were probably more affordable pre-pandemic. People who are living in the Bay Area or areas that have higher housing costs have now moved out to these areas because guess what? They're more affordable to them. And that ripple effect has caused a lot for people who had hopes of buying homes, say, in the Sacramento Valley region, or the, just kind of the areas right out of the Bay Area that were more affordable. They're now skyrocketing. It's incredible. Areas that people would not have thought twice about moving to are now out of their reach. And I can only imagine what that means to people who were just barely making it on the precipice of renting and thinking of maybe trying to get something small so they didn't have to rent anymore, and how then that affects people who are now being pushed into homelessness, who can't afford the high rents or housing. So it's just a bigger scope of a kind of a wave of change that's been caused by this pandemic. And I don't see it, there's an ebb and flow. I don't see it changing. It's just gushing forward. So just something to consider. Thank you.
Thank you. Okay. Finally, Councilmember Imbasiani.
Hi, good afternoon, everyone. It's a pleasure to be among so much talent and passion. Hey, I'm the Secretary of Veterans Affairs, and my question is not at 30,000 feet, but really at a very low level. It's not about poverty or housing stock, it's about landlords. And I'm going to address my question to anyone, not just the guest lecturers who did a wonderful job, but anyone in state government who does research. It's come to my attention that many landlords in the state are resistant to receiving vouchers, housing vouchers, supplied sometimes by the federal government or others, like HUD vouchers, or in the case of the veteran community, HUD-VASH vouchers. I'm aware of a situation in San Diego where I think it was the city council, maybe it was the county, I think it was the city that actually voted and for a number of years supplemented HUD-VASH vouchers to make them more attractive to otherwise resistant landlords. I'm wondering, do you researchers think that this is a fecund area of research? Do you think this is an area where the people on this in this interagency council could lean on certain groups of people in a, say in a Christian way, but in a very nice way, twist elbows, make something happen? What do you think?
So I think there's a lot of research on discrimination among people who have vouchers. We know that this is a longstanding problem. California actually passed a law that prohibits landlords from source of income discrimination. The challenge is enforcement. The challenge is actually at the moment that the renter or the person is trying to rent a unit. And so I think that this is we don't need more legislation. We probably don't need more research, but we do need to figure out strengthening enforcement of the source of income discrimination laws.
Thank you.
Okay, and I see Secretary Galley, our co-chair, is back. Thank you all so much. I'm going to go ahead and turn it over to my co-chair, Secretary Galley, to close us out.
First off, I'm jealous that I missed all of the terrific presentation. I came in just while the questions were being asked, but it sounds like a terrific set of conversations. I think, Lisa, you're the one who said it. Housing is medicine. I think that is a terrific phrase to come from one of the, I don't think you're a clinician, but I mean, I think so many clinicians focus, Margot, Vito, others who spent a lot of time trying to figure out how we sell that link. I had the privilege of creating something called Housing for Health in Los Angeles that was based in the housing or the health services department that really sought to house homeless, sick people with a lot of novel and creative solutions. So excited to hear that link. I will be honest, Lourdes, I'm not sure where we are in the agenda.
No worries.
I can.
Is it back to Julie? I think it's back to Julie. Okay.
Yes, perfect. Item number 7, Julie, council activities.
Oh, great.
Thank you. Thanks to you both. Before I move to the focus of this particular agenda item, to share some information about what council staff are up to, especially as it relates to this committee, I do have a couple timely announcements. The first is that in sort of related to what our speaker Ann shared today, I would also like to make a note that the California Interagency Council on Homelessness is seeking qualified applicants to establish and administer a lived experience advisory board to inform the implementation of activities throughout the Cal ICH statewide action plan for preventing and ending homelessness, and also to advise as needed towards our HAP program, and to encourage and support communities to further center voices of people with lived experience. So I'll put a link into how you can get more information about that. We are trying to get the word out quite broadly so that we have a really diverse pool of applicants for that RFP. And secondly, I'd also like to announce that Council Member Tim Rainey, representing the California Workforce Development Board, has joined our meeting. Welcome, Tim. And I'll pivot back to this agenda item. And so I'm thrilled to share what our council staff will be up to between now and our next council meeting. As both our chairs referenced, the action plan for preventing and ending homelessness serves as a roadmap to our shared work. May I please have the next slide? I'd also like to extend our deep gratitude to the foundational work that our prior council established. As many present today are aware, Cal ICH will be carrying forward the foundations laid by the HCFC by moving the action plan for preventing and ending homelessness forward. The action plan orients the state's work and our shared commitments to actions through 5 action areas. And importantly, we do report back on that progress. Our priorities between now and the next meeting are to work with our new council departments to assure that their priorities and actions are reflected within the plan, and further to update the actions from our returning departments. We're eager to report back to this council later this year to present a package for your approval. One more quick update. We are eager for the formation of the advisory committee to this council. With this first meeting and launch underway, we will be moving to establish this key informant group to this council. We will share more information as it's available. We have a lot of work ahead of us, and I'm excited about the year ahead. Next, I'd like to turn to Cal ICH's grant director, the mighty Victor Duran, to talk us through an important facet of our work in relation to our local action planning. Victor, please take it away.
Thank you so much, Julie, and thank you to all of you. I'm so grateful for this opportunity to be here and to talk with all of you about the local action planning process we'll be engaging in, especially since all of you represent the full spectrum of systems that will be critical to the action plans that we'll be carrying out. So by way of a little bit of background, as many of you are aware, The Homeless Housing Assistance Program, or HAP, is the principal direct local assistance program administered by Cal ICH, and it provides significant investments to local communities, local homelessness response networks across the state in support of regional coordination, capacity building, and of course, direct services. To date, we've already dispersed nearly $1 billion in funding, with another $1 billion to be dispersed this year and another $1 billion to be dispersed next year. And with these new rounds of investments come new accountability measures, including a local homelessness action plan and specific measurable goals. At a really high level, I'll share that these plans will include data and analysis on the local landscapes, descriptions of some of the local issues, assessment and an assessing of the broad range of resources and partnerships at all levels that the local communities will be bringing to bear. And as we've been discussing these local action planning processes with the local communities, we know a lot of them are very accustomed to creating a plan for whatever program they're going to administer. But this is a little bit different. We've really been emphasizing that while these local action plans are attached to the HAP program, these aren't the HAP plans. And in fact, they're not even the local homelessness response system plans. They are the plans that are intended to represent bringing the full universe of relevant systems, partners, and resources to bear in order to end homelessness in their communities. And that includes those systems, those partners that may not typically be thought of as part of the local homelessness response system. So this new process, which will be pivotal in the added accountability and outcomes that we're working to achieve, is really important. But more important than the new process is the culture change that it represents to bust the silos, as Secretary Valley mentioned earlier, and bring whole person services needed to achieve lasting change. And so what's really exciting about this opportunity to speak to all of you is that this newly reconstituted Council of Leaders really reflects how the state is modeling this culture change that we hope to see from our local leaders across the state. So that said, the timing of this conversation can be better because my team is preparing to engage with the 76 communities across the state that have submitted HAP proposals and to develop the local action plans or provide support in the development of their local action plans in the coming months. And in support of these engagements, we are so excited to hear from all of you, the leaders at the highest levels of the different systems that our local partners will need to leverage to end homelessness. So I know we're a little short on time, but recognizing that this will be part of an ongoing conversation with you, with your senior staff through our work groups. And so I'm really grateful for this timely opportunity to hear from all of you, to hear your perspectives on some of the priorities and key elements that we need to keep front of mind as we proceed through these engagements with our local partners. So with that, I'll turn it over to our esteemed co-chairs for the discussion portion of our agenda here.
And I'd like to just make a note before we open up for discussion. I'd like to just make explicit a couple things. We are actively seeking input from this council on what your vision around what a robust and integrated action plan might look like. Secondly, we will be bringing the totality of the action plan, the local action plans for council approval at our next meeting. And so a couple things to flag is we will be working, council staff will be working under your directive for what you're actually looking for within these plans. And so we really do welcome any questions in response to what Victor just shared. We know that that's it's kind of it's a big topic, and some folks may not have seen an action plan ever, and so we just want to make sure to provide as much information in detail. Please do. I want to open up the floor for any follow-up questions before we move into a broader conversation, both about the process and any information Victor just shared.
Councilmember Loving, do you have a question?
I do. Well, about the planning itself. Do you want me to wait?
No, I think this is good.
This is a great time.
Yeah, perfect.
So have we done mapping to understand which local jurisdictions already have plans? And the reason I say that is, we'll find a myriad of differences, right? Some communities, Santa Clara County, we have a very active, robust plan, right? And that's true in other places and probably less true in others. And so what's the appetite for flexibility as it relates to, I think conversations with local jurisdictions could really engage what specific needs people have instead of sort of a one size fits all. We have local dollars that could be deeply leveraged, right, by state dollars, but we have to have a conversation about it. And if money comes out just one way or plans come out just one way, then that actually hinders our ability to do certain things. And that will be differently true in different places, right? And so since we're starting, I wonder what the appetite is for a way to have flexibility around, the state should have one plan. We should have a number that we want of people we want to see get off the streets, a number of units that we want to see built, levels of affordability, numbers on people, preventing people from becoming homeless, guaranteed income strategies, also, all the different things, right? We have these big numbers, and then it seems like jurisdictions could sign up for their piece of that work.
That's a great question, Councilmember Loving. And you alluded to this already, and I'm sure no one on this call will be surprised to hear that as we've been connecting and reaching out to local communities, what we have heard is the wide spectrum ranging from, we have an amazing plan that we don't want you to touch, and in fact, we could school the whole state on how to develop the best plan that was ever made, to, oh my goodness, we don't even know where to get started. Please help us. Please send every resource you can to help us make this happen, and everything in between, right? And to your point, flexibility is really the name of the game here. And I feel so fortunate to be working with a program that centers flexibility, that recognizes that every local community is going to be different, is going to have different resources. So we do not intend to approach this with a one-size-fits-all approach. In fact, the reason that we are structuring it through individualized engagements, really conversations, is because we recognize that every community is going to have not just its own different constellations of issues, resources, and barriers, but even culture and local politics that kind of come into play. So absolutely, to answer your question, we are acutely aware of the broad range of where everyone across the state is at, and that we need to be very flexible to help meet folks, meet communities where they're at, rather than try to move communities into what the state, a one-size-fits-all approach coming from the state.
And I think with that, seems like no follow-up questions on sort of the
actually, Julie, JC just last minute hand up.
It was a late rate.
It's good. These are some of the best comments. Go for it.
So I wanted, obviously, Victor, and I appreciate, Victor, all the work you've been doing and working with our team here at DHCS as we forge into our new, world. I wanted to kind of at least raise up in this environment thoughts, either from the council broadly or even from you, as managed care plans kind of thrush themselves into this new world of like housing and homelessness. Well, they better have been in homelessness before today, but I'm just going to say thrush themselves into this world. What are your thoughts, or even other council members' thoughts on how to do that well, right? How to integrate it. Of course, we have a plan, and we plan on working with you, and Corinne, you've been great working with us as well as we kind of wrap our arms around this, right? But I think, we don't want it to be duplicative. For example, in the housing and homelessness incentive that we have approved, the 1.3 billion under the HCBS spending plan, one of the things we want is figuring out how managed care plans embed themselves in the existing structure. We don't want them to duplicate a structure. We don't want them to come in thinking that they have to run those things, but how do they appropriately embed themselves in the continuum, in the existing structure, and maximizing the kind of HAP program that's maybe already in progress, and how do they build themselves into that kind of local environment and engagement, instead of creating something separate. And so would love your thoughts, or if we get into a conversation or conversations around that. I just think it's going to be critical that we don't duplicate, but we enhance, we integrate, we fold into, and then figuring out how we provide that great technical assistance to our new partners in this space, so that they're successful in what we're trying to achieve with CalAIM, and bringing them the right technical assistance to do this well and to find the right people. And I know we have a number of tools and things that we're doing, but just wanted to raise it up one broadly so this council understands that new intersection of things as we kind of forge into CalAIM, and then acknowledge all the work that you and Corinne or others have been doing with our team as well.
Thank you, Director Cooper. I'm eager to hear from other members on this topic, but I will first start just by expressing my gratitude to your team. They've been wonderful to work with, and to Deputy Secretary Buchanan for reaching out and working with us as well. It's been so wonderful. And there's a part of me that thinks it was meant to be, because you've got the HIP program and we've got the HAP program. So I think HIP-HAP is going to be a great big success. So we are in close communication with the team. In fact, we'll be meeting with them, I think this coming Monday or Tuesday, and making sure that we're working towards alignment and not duplication. And in fact, one of the key elements that will be required in the local homelessness action plans is to explicitly articulate the different resources and how those different resources support strategies that support outcomes, so that we have that leveraging and alignment and not duplication. But I'll pause there because I think there's other comments.
Director Johnson.
Thank you. No, I was just actually going to double down on that kind of concept. It's bringing it all together. And that's, I think, what would be just most critical in these action plans. It's also on the social service front and how they're taking workforce and childcare and food supports and all of the kind of foundational social services as part of the whole. And that would be what I'd want to see kind of reflected. And so great, Victor, to hear that there's direct questions related to how locals are doing that. And I guess the other kind of point in maybe building on JC's question is if there are other things, especially this council and body can do at the state level to help make those intersections even more clear. I know that in the former iteration of this council, there were kind of the financing guides that talk to all of the different funding streams kind of and how these things can be blended and braided and leveraged. But I think on the kind of integration of health and social services within the package, if there are additional tools and resources that we can actually develop that would be of benefit to the local communities, also would be interested in hearing that feedback. Thank you.
Thank you, Director Johnson. Right off the bat, one thing I'll say is that it's already being reflected in this conversation we're having here, is for as we have these conversations with local communities about systems alignment and about busting those silos, that the leadership across the state representing those different networks continue to reflect that culture change. And I know that all of you will with your senior staff, and as we work with your senior staff and their more frontline staff, making sure that that message is trickling down across all levels and across all systems, so that the local communities see that the state is walking that walk, is walking that talk.
Director Demarois.
Ooh, pretty. Nice pronunciation. Susan DeMorris. Victor, it's very nice to meet you. And I just wanted to offer up, through the Master Plan for Aging, we have a local playbook and we have regional coalitions throughout the state made up of excellent aging and disability stakeholders. So we'd be so happy to partner and pair with you so that those voices and experiences are reflected.
Thank you so much, Director. I am thrilled to hear that. And in fact, in my prior life at DOR, I helped former Director Kim McCoy-Wade supported some of the aspects of development of the master plan. So certainly that is a key partnership that we plan to leverage. I so appreciate it.
Councilmember Clendenin.
Thank you. Just thinking about the individuals that we serve within the state hospital system, we serve individuals with serious behavioral health conditions who come to us through the criminal justice system, and the majority were experiencing homelessness before they engaged in their or engaged with law enforcement. And so just curious, the thought on kind of the involvement of the criminal justice partners in the local action planning process and plans, and then the consideration of the service of individuals and ensuring that there's access resources for serving individuals with serious mental illnesses, as well as those who have had experience and with the criminal justice system.
You know, without going too much into, I'll just say that that is a topic that is near and dear to my heart. It's interesting. I've been having a lot of conversations lately about how we can support and center people exiting incarceration and individuals who have experienced involvement with the criminal justice system, and ensuring that folks are not exiting incarceration into homelessness. So I can assure you that is very front and center for me, and in a number of conversations that we're heavily involved in, and that I'm ensuring that my team are keeping front and center as well. So I'm so glad to hear that on this front as well. And then as I'm sure you know, there's a lot of exciting opportunities evolving on the behavioral health front, specifically resources aimed at individuals experiencing behavioral health needs and experiencing homelessness. And so in the local action planning, really explicitly looking at how both existing and emerging resources will be part of those efforts is certainly going to be a part of that conversation.
And I'll also add, this comes to mind, is that part of the local action planning process is both approval at the state level, but local communities are also required to pass their plan locally. It needs to go before a local body. And I think this is where some of the opportunity exists for the state to continue to strengthen our relationship locally, so that we truly understand the individual systems. One thing that I've learned during my time at Cal ICH is, every community is sort of has a different composition of services and departments and folks who are in charge. And some of the reasons why we included that as a requirement is we understand that the local communities that will be implementing really need to authentically own what that plan would look like that is viable in their setting. And so I do want to flag that within every jurisdiction, folks are thinking about who is going to hold these different bits of work. And I think to Councilmember Loving's point, there are some communities that are going to be really far ahead, that are very well integrated, and there are some that will be sort of spurred to move into action to become further integrated.
Hey, Julie,
Okay.
thanks. I think we're in a good place with this conversation. I want to also suggest, as we wrap up this agenda item number 8 and move into number 9, but that we will also, as part of the council, use occasional reach outs by a survey. I've used it in other forums, and it's really a great way to, without rushing the conversation, to get meaningful feedback. We'll share that survey publicly, post responses from council members that allow us to give you a little bit more time to think through what do you want to see in these action plans locally or at the state, and give us a chance to really marinate over those and bring them back into future conversations. So by way of wrapping up, really appreciate the discussion. I think there'll be more cracks at the apple, if you will, on making sure that your fingerprints are part of this conversation, and the areas of your deeper concern and general concern are reflected. But Victor and Julie, thank you so much for facilitating that conversation. Julie, as the master of the flow here, is it okay to go right into the consent calendar? Catch us up just a little bit. Perfect. So I think we have, there's not a lot on the consent calendar, but we do have to approve the adoption of the meeting summary from November 3rd council meeting. I'm not sure exactly how we're going to get that done, or do we have a motion and then move it, because this is an action item? It's Julie, is that how you want me to handle it? Okay.
Yeah.
I'll move the consent calendar for approval.
Thank you. Great.
Second.
So we can pause for a minute on public to see if there's any public comment on the consent calendar.
Yes, thank you very much. So if there are any public comments on the consent calendar in particular, please take this opportunity to raise your hand on your meeting window or press *9 on your telephone. As a reminder, this is just for comments on the consent calendar. We will have an open public comment period just a little bit later in the meeting. As a reminder, you'll have up to 3 minutes to make your comment. It looks like we do have one comment on this item right now. So Jeffrey, you have 3 minutes to make your comment.
My comment is that I asked to be put on the distribution list so I would know about this meeting. Unfortunately, that didn't work out. I was fortunate that today at 3 o'clock or at noon, Channel 3 was telling that this was going on. So that's how I was able to listen to this. I will leave it at that, but note your publicity needs to be better. I will speak later at the open time, but I also have a Zoom call to be on.
Thank you for your comment. We have a comment from a call-in user, phone number ending in 932. Caller, you should be able to press *6 to unmute and make your comment.
Hello, my name is Nino Parker. I'm a homeless advocate in Oakland, Lake Merritt homeless Black advocate. I just know this isn't a proper time for maybe this comment, but I'm just really trying to see if I can find out how to get information from the people on the panel. I as a homeless advocate here 8 years in Oakland, and I've met the mayor and many of the city council people know me as well. If there's some way you could contact them, I could get contact information. This is my first time getting into a statewide meeting. I've been in city council meetings almost every one for the last 4 years. But yeah, I would love to learn more about this and be involved in some way as a homeless advocate here in Oakland, California. Thank you.
Thank you for your comment. I see no additional public comments on this item. So I believe we can move to a roll call vote. So Council Co-Chair Lourdes Castro Ramirez.
Yes.
Council Co-Chair Dr. Mark Galley.
Yes.
Councilmember Susan Damaris.
Yes.
Councilmember Kathleen Allison.
I need to abstain as I was not at that meeting. Thank you.
Council Representative from the Office of Emergency Services, Lisa Manga.
Yes.
Yes. Councilmember J.C. Cooper.
Yes.
Councilmember Rebecca Ruan O'Shaughnessy.
Yes.
Councilmember Gustavo Velasquez.
Yes.
Councilmember Tina Johnson Hall.
Yes.
Councilmember Tomas Aragon.
Yes.
Councilmember Joe Xavier.
Yes.
Councilmember Kim Johnson.
Yes.
Councilmember Stephanie Clendenin.
Similar to Secretary Allison, I was not at that meeting, so I will abstain.
Certainly. Councilmember Nancy Robles.
Yes.
Representative from Department of Transportation, Elisa Becerra.
Yes.
Councilmember Vito Imbasiani.
Yes.
And Councilmember Tim Rainey.
Yes.
Councilmember Jennifer Loving.
Yes.
Councilmember Amy Anderson. So we have 15 votes in favor, 2 abstentions, 1 no response. The motion does pass.
Thanks, Evan. I think what I am also going to do, Chair's prerogative, is move us and agree that setting up agenda items for future meetings, that we can also get feedback from council members by way of survey and move right into, if that's okay with you, Secretary Castro Ramirez, move right into public comment. So we have the remaining time for the public comment.
That's, yeah, that's absolutely okay. So we can move on to item number 11, public comments and final remarks. And so we'll turn it back over to you, Evan, to provide instructions and facilitate this portion.
Certainly. Thank you very much. So again, this is the open public comment period. If anyone wishes to make a public comment, please press the raised hand icon on your screen. You'll then be called on and have up to 3 minutes to make your comment. If you're connected by telephone only, you may press *9 to raise your hand. So our first comment comes from Tim McCormick.
Hi, can you hear me?
Yes, we can.
Hi.
Thank you.
Great. Thank you to the panel and the organizers for a very interesting event. My name is Tim McCormick. I'm a former Californian, now displaced in Portland, and director of Housing Alternatives Network. The question and part comment, we see that creating housing is, of course, very costly, and also that there is a wide variation in unit costs between some past conventional new building versus conversions versus some innovation projects, such as the Life Moves Mountain View, which came in $100K per unit. Hotel conversion is offered a great opportunity, but the stock there is limited and dwindling. So my question is, to facilitate ongoing new housing availability in a scalable and sustainable way, how might we develop platforms and programs to better incubate, share, scale, and redirect effort to lower cost, faster, and possibly new project types, bringing a perspective to it that we don't necessarily already fully know the answers or act upon them? Thank you.
Thank you for your comment. We have a comment from Jeffrey. I apologize, I'm probably not going to pronounce your last name right. Tardagula. You have 3 minutes to make your comment.
The first thing I will ask Dr. Galway is please get a hold of Caltrans and ask them to speak to the local homeless counts for the pit, because I can use Sacramento as 65th Street because of the construction going underneath the freeway, turn around and displaced 30, should we say, an encampment of 30 tents. That made 2 more new encampments, and of course, people scattered. It would be helpful for the point in time count up and down the state if Caltrans would make sure that the homeless counts would know about this, so that there would be some coordination, not just saying, well, nobody responded and we talked to the city. That's something that I believe this council could do. And of course, as Dr. Galway knows, I have always encouraged and said, where is the client, the person that you are dealing with? It would be great if someone on the council would be there to give you an insight into the client, the homeless person, of what's going on. I am involved in the Sacramento point in time count, and every time we have counted, the populations have doubled. This year, I expect encampments to be larger, and this year I expect a large number of RVs. To some of the speakers have spoken about what is going on. I have in my own, shall we say, rental apartment complex where 3 people being evicted and 2 not being able to get in because they were on a SSI recipient. So know that yes, enforcement and encoding and other things need to be better to address getting the avoidance and getting the other. The third thing I think would be is a definite plan for how do you rent under $1,000, because that is the ultra low income. How do you come up with the plan to house the under $1,000 situation? Not even talking about the 30 and 50%. If you can come up with a plan of how to house that, I think you would address a major ultra poverty level need to keep people in. And you need to develop best practices and procedures for safe camping, for safe RVing, for other safety standards and processes and procedures. And lastly, please add me to your list so I can pay attention to what you're going on and doing. And I'm hoping that our epidemic of COVID, which has got 2 more stages now dealing with this Omicron, does not prevent in February Sacramento. I know that last weekend, San
Thank you for your
Joaquin
comment. Your
did-
time is complete. Please make your final comment. All right. Looks like we are going to move on to comment from Joe Coletti. Joe, you'll have up to 3 minutes to make your comment. Joe Coletti?
Yes, Joe Coletti, Urban Initiatives. Everybody can hear me?
Yes, thank you.
I would like to quickly describe why the ICH has a narrow window of time to base the allocations of HAP Round 4 funds on a point in time count that collected data in the midst of the pandemic, instead of basing the Round 4 allocations on the pre-pandemic 2019 point in time count, which, as you know, was used to allocate HAP Round 3 funds. Early next week, we, Urban Initiatives, will send out a report that will show that some of California's 44 continuums of care conducted their 2022 homeless count within the last days of January, and that most of the COCs will conduct their 2022 homeless count within the last 10 days of February instead of January, after receiving approval from HUD because of pandemic-related reasons. The 2022 point-in-time homeless count will provide an opportunity for you, ICH, to allocate $800 million later this year based on homeless count data gathered successfully and safely by the 44 COCs in the midst of a pandemic that has surely impacted homelessness statewide. As you know, HAP Round 4 founding was approved by AB 140. AB 140, however, states that the ICH, quote, shall make an application for Round 4 program allocations available no later than September 30th, 2022. You may know that historically, HUD does not publicly release point-in-time count results until the results are reported to Congress during the fall. Therefore, the point-in-time count data collected in January and February of this year will likely not be publicly released by HUD until October or November or later, which is obviously after your September 30th deadline. However, historically, HUD requires COCs to submit their homeless count results through its homeless data exchange around May 1st. As a result, the ICH can ask each of the 44 COCs for their total count of unsheltered and sheltered persons reported to HUD around May 1st, and then determine the total number of persons counted statewide, and then provide non-competitive HAP Round 4 allocations to eligible grantees based on their proportionate share of the state's total 2022 homeless population, which you can determine by adding all of the 44 total counts, just like HUD will do later this year and has done in past years. I am sure the 44 continuums of care will be willing to share their total homeless count numbers with you, however, with one caveat. Allow me to conclude by briefly describing the caveat.
Thank you for your comment. Your time is complete. Please make your final comment.
Most or all of the 44 COCs prefer to make their homeless count results known after they make their homeless count results first known to local stakeholders.
Thank you for your comment. Next, we have comment from Rena Burns. Rena, you have 3 minutes to make your comment.
Thank you, and thanks everyone for the wonderful work that you're all doing and with funding policy and program models. You know, with the interagency communication, you know, I think about the technology systems, and there's legislation, the Families First Prevention Services Act, that is for the benefit of prevention services for children and families at risk. The current child welfare system under development and the current statewide HDMIS system, your homeless system, it would seem there might be opportunities for review and identification of points to share data to identify some of these families and keep them in their homes with, and this legislation only further, reinforces what you are doing currently as a state. So if someone isn't looking at that, that's my comment, a suggestion. Thank you.
Thank you for your comment. We have a comment from Helene Schneider. Helene, you have 3 minutes.
Hi, good afternoon, everyone, and thank you so much for the opportunity to speak. My name is Helene Schneider. I'm the regional coordinator covering California for the U.S. Interagency Council on Homelessness. I just want to commend the staff here in putting together a very well-informed and wonderful number of presentations, and to thank all the speakers, and really just to introduce myself to those who I may not have had the chance to interact with on the council. Love the new name. ICH is the way to go. So let the US ICH and Cal ICH continue its partnership between federal and state leaders as we work together on reducing and ending homelessness throughout California. I speak with Julie Lowe and staff quite often, and so please feel free through her if you need to get a hold of me and want to connect on federal partnerships with the 19 different federal agencies that I work with through Washington, D.C. and through USICH. I'm really looking forward to continuing our partnership. Thanks so much.
Thanks so much. Next, we have one additional comment from a call-in user ending in 345.
Can you hear me?
Yes, we can. You have 3 minutes for your comment.
Thank you. My name is Asada Oligbala. I'm a resident of Oakland, California. I'm currently protesting outside of a homeless tiny homes encampment, Lake Merritt. The reason why I'm protesting is because the site has 2 sites. One is called a co-governance site. The other one is managed by the consortium of the East Bay, Housing Consortium of the East Bay. This pilot program has 90% of the residents white. The homeless population of Oakland is 70% Black. The protests, we want them to take down the fence and not have a separation of a homeless community, but not to have a co-governance program that's 90% white and the homeless is in Oakland is 70%. Along with that, they have disproportionately services and resources. The people who have the majority white homeless have showers. The people who are not who are predominantly Black on the other side of the fence do not have showers. The portion of the people who are called Union Point, they have their own individual storage units. They're building them a kitchen. That's not the case on the other side. They have a stipend of $87,000 to do their own security. They also have a stipend for $30,000 for leadership training. The people on the other side who are predominantly Black do not have stipends or the ability to have that. The individuals who are a part of what is called Union Park have the ability to go on the other side to use the waste management disposable, but the people on the other side cannot go on their side. It's horrible. It's horrible that we have this kind of situation, segregation. I grew up in Jim Crow. I'm 76 years old. I'm out there every day for 2 months protesting in the discrimination of having separate communities where one is predominantly one race, white, and the other one is, it's diverse, but that's not fair. And they are spending money. They have cameras on one side for their protection. There's no cameras on the other side. So we have to do something. I've been out there 76 years old for 2 months trying to get the city to do something to end this, take down the fence, make the whole community an integrated community with co-governance for everybody. They had to fire the management because he knocked, the only other protester knocked him to the ground. he got fired. It's horrible. And the city is not listening to us. We have to end any form of discrimination or segregation. And that fence has to come down. Thank you for the time.
Thank you for your comment. We have another call-in comment from phone number ending in 932.
Hello, my name is Nino Parker. I'm the homeless Black advocate, Lake Merritt. I would just like to start off by saying everything that Ms. Sada Al-Abala is saying is true. I don't want to have to reiterate everything she said. I have been protesting with her for the last over 2 months and 10 days, I think it is now. Everything she said is something that we really need to handle. But I think it would be probably easy for you to look for the East Bay Times article, which I believe was out last week or a week and a half ago, and it will give you the whole scenario. Unfortunately, it was written biasly in favor of the white folks from the Alameda Point Park side, and didn't say much about my particular protest. It says it's a small protest, but anytime you're protesting against racism, I'd have to say to Miss Marcel Kindle that wrote the article, anytime you're protesting against racism, it's not a small protest. It's a nationwide protest. It's just a small part of a nationwide protest when it comes to discrimination and in a apartheid type situation like we have here at the Lakeview Tiny Homes here in Oakland. We'd love for anybody that like to participate and come out and see what's going on here, not necessarily to participate in our protest, but come out and take a look for yourself. It is there's a fence running down. It's like so unbelievable. I can't believe in 2021, we have a segregated community that Oakland is allowing it to happen. And when we do get that fence down, it will not be no win for us. No one will be gloating. It shouldn't happen in the first place. We just want fairness. We don't want to have a pilot program that starts off with tiny homes saying like we're going to have whites on one side and blacks on the other side, with the whites having advantages. They got $350,000 off the top for their own personal spending, basically for security and food and other things, while on the other side of the fence had nothing. And in the time frame of this article that was written in about 2 to 3 weeks ago, a man died right next to the tiny home encampment. He laid in his tent for 3 weeks. He didn't have a face. The maggots ate his face off. So on one side of the encampment, you have this beautiful, well-groomed white side with cameras and satellite dishes. And the other side of the encampment, you have a mixed people that are actually from Lake Merritt that lived at Lake Merritt, and they got some of those in there. And then right next to that side of it is the people on the hill where the guy laid in his tent dead for 3 weeks while everyone is having a wonderful time on the other side of the encampment. I would love for anyone, I can't give my number out over the phone, but I am easily contacted through City Council. I'm not going to take this any farther. I appreciate your time, but this should not be happening in 2021. Thank you.
Thank you for your comment. I see no additional public comments at this time.
Great. Evan, thank you for facilitating that. Appreciate it. Julie and Secretary Castro Ramirez, Corinne, I think we're a little over time. Maybe just quick by way of wrapping up. Lourdes, do you want to offer us just some final comments?
Yes, thank you so much, Co-Chair. Thank you, Dr. Galley. Just in closing, for members of the public that joined us today, thank you for being part of this meeting. For those of you that were able to provide a public comment, please know that we're all listening very carefully and making note of the comments that were shared. Of course, the guidelines don't allow us to directly respond, but we are listening to your comments. And just, council members, what a privilege, to be able to share this space together with all of you. I think that this meeting, as Secretary Galley and I, working closely with Corinne and Julie, planned, for this day and for this meeting. I think that what we've accomplished today clearly surpassed, I think, our greatest expectations. The the presentations by Ann English, by Dr. Kushel, and also Carolina Reid clearly created a lot of conversation, a lot of questions, and I think it really it enabled us, right, to think more carefully about why this council and why working across agencies and departments is critically important, right? Health, housing, supports, housing affordability, these are all things that are connected. And so we look forward to continuing to work very carefully with all of you. And again, just kudos to the staff for making this meeting happen. So with that, I will mention just for members of the public that have joined us, that all of the materials of this meeting, including the meeting summary, will be posted on the council's website for the next meeting. We also, for members of the public that would like to receive information in terms of the council's activities, access the presentations that were shared today, you can do so by visiting the council's website, which is at www.bcsh.ca.gov/CAL-ICH. And it's, thank you so much, Evan, for posting that on the website here, or on the screen here. We also, of course, have several social media platforms and encourage you to follow us on Twitter, Facebook, and LinkedIn. We know that we could definitely do better with outreach, and so thank you for that feedback. With that, Secretary Galley, I'll turn it back over to you to close us out.
Yeah, great. Thank you, Secretary Castro Ramirez. And just to all the council members, thanks for taking the time. We know everyone is super busy, lots of balls in the air, trying to do terrific things in so many different arenas. To take the time here and the thought to really amplify the issues that we're thinking about, lend your expertise and your thoughts that are super informed and terrific, and to the presenters, just really appreciate the whole lineup and look forward to all the work that happens between now and our next meeting in your individual work, but hopefully connecting all the time to this broader goal. So with that, thanks again. Enjoy the rest of your afternoon, and we'll see you soon.